Hello everyone, welcome back to my channel. In this video I'm going to talk about a neonatal care. In the last video मैंने बात करी थी आपसे neonatal resuscitation के बारे में, and in this video let's get started with the neonatal care. It is divided into three conditions. First, if the condition is preterm delivery or preterm gestation, that is less than 37 weeks, then the features of the neonate will be low birth weight LBW less than 2.5 kg or equals to, crown heel length is equals to or less than 47 centimeter, head circumference is less than or equal to 33 centimeter, chest circumference is equal to or less than 30 centimeter, abundant body hair will be present, scalp hair looks woolly and fuzzy, breast nodules is less than 5 millimeter in males, baby, undescended testis, small scrotum and less rugosities. In female, body exposed labia minora due to separated labia majora is present. Parameters like consciousness, activity, reflexes and muscle tone is altered in such conditions. Now if we talk about the complications present in the preterm neonates, is the respiratory distress syndrome. First is the respiratory distress syndrome, bronchopulmonary dysplasia, pneumothorax, congenital pneumonia, pulmonary hyperplasia will be present, pulmonary hemorrhage, apnea, hypertension, hypocalcemia, organ hemorrhage, hypothermia, intraventricular hemorrhage, hypotonia, hyponatremia, hyperkalemia. All are such the conditions which are present as a complication in preterm. Renal glycosuria and edema may be present. Management. General supportive care will be given to the neonate. Normal respiratory gas exchange, cardiovascular functions को support करने के लिए we will give the general care, which includes the thermoregulation, appropriate fluid balance, nutrition and growth. Prognosis will depend on the quality of care given to the neonate after the birth. Now next we will talk about the post-term infants which is greater than 42 weeks of gestation. Features will be infants are less alert and infants are more alert and mature. Nails or fingers and toes are long. Increased birth weight, absence of linago, decrease or absent vermix caseosa. Now if we talk about the complications of the post-term neonates, is that they may present with congenital malformation, perinatal hypoxia, meconium aspiration, hypoglycemia and polycythemia. Prognosis and care. Neonates with meconium aspiration may develop chronic respiratory insufficiency. So in that case, where there is a chronic respiratory insufficiency and secondary pulmonary hypertension may develop, so surfactant replacement theory is helpful in such cases. And next what we can do is early feeding is encouraged in post-term neonates. Oil and cold cream can be recommended for prevention of dryness of the skin due to the squamation of the cells of skin, epidermis. Now if we talk about the full term neonates, that is 38 to 42 weeks, we have to do the neonatal resuscitation के जितने भी steps बताए गए हैं जो कि मैंने last video में upload किए हैं, प्लीज़ वो आप जाके देखेंगे, तो वो सारे प्रोसेस करने हैं, स्टेप्स करने हैं, दैट इज़ आफ्टर neonatal resuscitation. साथ में with prevention of hypothermia, eye care, presence of congenital malformation, vitamin K administration, essential postnatal care is to be given to the patient. We will check for certain signs of the neonates. Immediate care में we have to prevent the condition of, we have to maintain the temperature, that is prevention of hypothermia. Eye care, that is 2.5% povidone iodine solution is to be given. 1% tetracycline ointment can be applied if in case of any to prevent any infection. Congenital malformations may include single umbilical arteries, dysmorphic features, excessive drooling of saliva, imperforated anus, esophageal atresia, tracheoesophageal fistula and all. Vitamin K administration is important here to give, as it induces the production of active prothrombin जो कि birth के time पे कम release होता है, and is injected into vastus lateralis muscle of the neonate. Now essential postnatal care includes, so we have already read about this in our video of neonatal resuscitation.